Bismillahirrahmanirrahim. My name is Dr. Amber Arshad, and today my topic of presentation is Sources and Use of Health Information System and HMIS in Pakistan under supervision of Professor Dr. Saira Afzal. In this presentation, I shall be highlighting the introduction to HMIS, what are the sources of health information system, what data sources are used in Pakistan, what are the uses of health information system, how HMIS is gathering information in Pakistan and working efficiently, recent advances and MCQs at the end. At the end of the presentation, the participants will be able to describe the data sources, tools, and how HMIS gathers information in Pakistan. Now, a brief introduction to HMIS. Health management information system is one of the 6 building blocks essential for an health system strengthening, and this HMIS system is a data collection system that is particularly designed to support the planning, the management, and the decision making in the health facilities and the organizations working in a joint health system in a country. Now, coming up to the sources of health information. First of all, I will explain the sources of health information that are generally used for different health information systems, and then later on I shall focus on the health management information system and its data sources or tools. So in our country, generally in every country there is 2 kinds of data that is used for as a source for health information: the health data and the population data. The health data is the continuous monitoring of the births, the deaths, and the vital statistics in the population. And also there is a population data. So generally there are 12 data sources that are used by different organizations and different governments for collecting data for making their health information systems. So one is the census, second is the registration of the vital statistics, third is the notification of disease that covers notifiable diseases, hospital records, disease registers, epidemiological surveillance, oral health service records, environmental health data, health personal sources, population surveys, and non-quantifiable information. So there are data sources that are mainly used in Pakistan. I shall be explaining them in detail. So for population data, in Pakistan, 4 sources of data tools are used. One is the census, that is an intermittent process. Second is the registration system, that is the continuous process. And third is the sample surveys. This is also an intermittent process, and a qualitative data is also used that focuses on the attitudes and the views. Now there is a registration system that is working in Pakistan, and there is continuous recording of demographic and social changes of population. And the complete population register is working since 1998 under the name of NADRA, that is National Database and Registration Authority, that registers every person that is of more than 18 or 18 years of age. And it has multiple feed and user agencies that provide data to the National Database and Registration Authority. Second, there are also some sample surveys done on provincial and district level and as well as national level. And these surveys are done to check the accuracy of the census and the vital registration systems. And it mainly conducted by the government agencies. So several sample surveys of Pakistan includes, first is the Pakistan Demographic Survey, the Pakistan Demographic Survey that reports the birth stats, estimates the current natural increase and characteristics of the population. There is also National Health Survey of Pakistan that reports the morbidity patterns, the risk groups, nutrition, smoking, non-communicable diseases, vision and occupation profile. There is another survey that is in Pakistan, is the Pakistan Integrated Household Survey. that monitors, that gathers data on family size, fertility rates, utilization of health services, education, water, and sanitation. Others are household integrated economic surveys focusing on household sizing and savings. Multiple indicator cluster surveys of Pakistan by undertaken by Ministry of Health and UNICEF, and these programs focuses on children education, water, sanitation, nutrition, the communicable diseases, and weaning and vaccination. And last is a national nutrition survey being carried by the Khan University and UNICEF. Now, fourth tool used for the data collection or as a data source in Pakistan is the census. The type of census that collects info about the people according to their usual residence, irrespective of where they are at time of census, is de jure census, and this is the type of census preferred in Pakistan. And in Pakistan, people don't talk about the guests who need to be reported in the de facto. So there are two types of census, the de jure census and the de facto. And in Pakistan, the de jure census is the preferred type. So what are the advantages of this type of census is that it's real and close enumeration of population can be done. And it's also reliable because there is sufficient time period available for collection of the data, and wide variety of data can be collected with this type of census and can be used for policy making. But there is a disadvantage related to this type of census is that it is time taking, and one of the disadvantages is that people permanently not living at their homes, they are not reported. So there is undercounting, double counting if after giving data people migrates to their own towns, and after births and death there can also be double counting or undercounting. For qualitative data includes the information on health policies, the public attitudes, the program costs, the procedures and technologies. The information related to all these categories come under qualitative data that is added to the health information system. Now, second was the health data. For the health data, we in Pakistan, two sources are used. One are the data from the health facilities, and the second is the disease and from the disease surveillance. So data from the health facilities is generated from the health facilities through a system through a proper system, and it includes first of all the disease notification system. This system is made for the notifiable diseases that are under national international surveillance. It also includes diseases like cancer, strokes, congenital defects, and blindness. So these diseases are notified to the information system. It gives us the opportunity for an early warning of the diseases, and we can also see the disease fluctuations. But the limitation to this system is that there can be underreporting, and atypical cases can escape, and it covers only few diseases. So this is a limitation for this system. Second is the disease registers. So permanent records with follow-ups of some diseases like strokes, cancers, TB, leprosy, congenital heart defects, and blindness. And this type of disease registers maintained in the hospitals is used to study the course of disease, the survival, and it gives the valuable data on morbidity and treatment. So whenever we need data on disease morbidity, the survival data, and the treatments given to the patients according to the diseases can be taken from the disease registers maintained in the hospitals. Other hospital records for these can be in the electronic form or they can be in the form of papers, and it's mostly used for the prevalent diseases and primary source data for the countries where, and mostly where the notification system or the online or the electronic systems or vital registration systems is weak, then hospital records are used as a primary data source for the countries. And it gives information on health service and utilization. And there is also information taken on patients' demographic characteristics, relationships between disease and the diseases. But the limitation to this, source of data is that only the tip of iceberg is included. Who seeks the care at the hospital? Admission policy may vary. Provides numerator only and not the denominator, that is the population at risk. To study the frequency of the other health service records include the data from the primary health centers, the MCHC polyclinics, the private clinics, and the school health records, and it's used to monitor the child growth parameters from the, for example, from the MCH centers. But limitation is that it represents only certain segments of the population. Now, second source of obtaining the health data are the surveillance systems, and these are often the part of the national disease control programs for some epidemic and endemic diseases like TB, malaria, COVID-19. And it gives valuable data on morbidity of specific diseases. There is also a behavioral surveillance that focuses on the risk factors of smoking and malnutrition. A program population surveys are population surveys are um, population surveys are mostly the household surveys that are conducted in Pakistan. It gives health information systems, and the health information systems should be population based. So the three types of surveys that are commonly being carried out in Pakistan are the community diagnosis that gives the health status of the population, and whenever we want to find out the etiology of the diseases and the causes of the relevant diseases, then we go for the disease factor investigation surveys. And last is the health surveys for the utilization and cause that include PDHS, NHSP, and NNS. So there are four methods of surveys commonly used. The first is the interviews. Second is the examination that is valid. Third is the health facility record that is cheap, and mailed questionnaires that is cheap and simple. But there are some disadvantages. Like for interviews, there is a chance for unreliable morbidity data. And for examination data, although it is valid, but it is expensive on its behalf. Health facility records is cheap, but is not population based and uniform. So this is the disadvantage for such type of surveys. And mailed questionnaires are cheap and simple, but the non-response and then is high, and literacy is also needed for such type of performing such a type of surveys. There are also health manpower stats that are given by the PMC and mapping of the health facilities. The environmental health data is the identification and quantification of disease data, and the non-quantifiable information is related to policy programs and costs. And modeling, estimates, projection, and research is also the part of the health information system. Now, this is the diagram showing the data needs and essential sources at different levels of the healthcare system. So starting from the communities, the tools for the data collection are the CAP studies, the local household surveys, and the surveillance. At the level of the health facility, the facility records, the birth registers, the outpatient data is important, and surveillance. At district level, surveillance, service availability through mapping, administrative data, and surveillance are the sources of data collections. And at provincial level and at the national level, the vital registration, census, and national household surveys provides the data. And at global level, modeling and estimates along with the vital registrations and the census provides the are the tools for the data collection. So what are the uses for this health information? This health information helps in measuring the health status and also quantify the health problems prevalent in the country. For local, national, and international comparisons of health status of the population of the country, these health informations are very beneficial. Also for planning, administration, and effective management. For assessing the effectiveness and efficacy of the health system, these health information systems can be used, and the source and the data that is collected under this health information system is also useful. And we also assess the attitudes and the degree of satisfaction of the people in the living in the country, and we can also use this data for research and training purposes. Now, from moving from HMIS to data sources or tools that are particularly used in an HMIS system in Pakistan. So in Pakistan, the HMIS is fragmented, as there are more than 20 different HMIS systems, and which use a dedicated vertical channel, and including the district health, including the district health information systems, management information systems, etc., working at different levels or at district, provincial, and national levels. So the data sources tools being used currently for the HMIS system, particularly in Pakistan, is the facility record systems, the OPD registers that maintains the most of the informations of the patients regarding the demographic characteristics, the disease, the treatments, and the main informations. The stock registers, the birth registration systems, the expense registrations, and the logbooks. So the patient record cards includes the OPD tickets, the referral forms, the MCH cards, the investigation forms, the family planning cards, TB cards, and vaccine cards. These patient record cards provides essential information regarding the patient's various diseases, their vaccination status, and also the people coming for the different control programs for their treatments. So for data transmission and processing, mostly monthly reports are used, yearly reports are used, or immediate reporting is used in case of an epidemic. And for the population data collection, the catchment area at the first level care facilities defined, and the data that is collected from this first level care facility gives the denominator for calculation of the rates. So there are several tools for in HMIS, and for example, for the lady health workers, there are several tools like Khandan registers, family planning registers, treatment registers, population area charts, and monthly reports. So these HMIS tools help each and every section to collect the defined and the segregated data. Whenever there is the collection of the data from the first level care facility, then it flows to the national HMIS cell within a 6 weeks time period. In the first week, the data is at the level of the first level care facility. Within 2 weeks, it reaches the district health office where there is district health management information cells. Then in 2 weeks, it goes to the DG health office, provincial HMIS cells, and for within 6 weeks period, it reaches to Ministry of Health and Natural HMIS cell. But there are some limitations to this HMIS limitation system. That is, there is poor data quality and limitations are present related to the poorly paced and managed staff. Absenteeism and poor national and provincial coordinations is another limitations. And no proper data is provided by the private hospitals, the GPs, the NGOs, and the referral care facilities. So there is a limitation in maintenance of the record at this level. And due to this limitation of HMIS from the different sources, the reporting is complemented by the district health information system. And now it has become the main source of information system in Pakistan. There has also been an initiative taken to develop an electronic disease and health indicator reporting system and a web application that are the dashboards that are working at the levels of different federal levels and provincial levels, like the dengue dashboard, the COVID dashboards, and this is linked with the provincial district health system and the selected health management information systems. And then the data from these multiple sources is entered and collected to the central database and then visualized through the web dashboards. I'm giving the example of Punjab. There is Punjab dashboard for communicable disease, namely the disease surveillance system, or the dengue surveillance dashboard, along with the COVID-19 dashboards are also operational. And in effective health now, For the effective healthcare system, we both need surveillance and HMIS to work in collaboration, to work in coordination at different healthcare levels, so that an efficient and an effective health information systems can be developed. This is a chart just to briefly explain the brief differences between the surveillance and HMIS. I would highlight only a few points. That for the surveillance, the main objective is the disease prevention. Whereas for the HMIS, the main objective is to maintain a good quality healthcare services. For the reporting in the surveillance, the reporting is often active, and the reporting is mostly immediate or on weekly basis. And in case of HMIS, the reporting is passive, and the reporting is usually on monthly and usually monthly basis. And the data is analyzed and interpreted periodically in case of surveillance, and can be used in case of daily during then epidemics, whereas the data is analyzed in case of HMIS is periodically, monthly, quarterly, and annually. So these are few differences between the surveillance and the HMIS. Now some recent advances. Recently, there has been a news related to the health management information system that highlights that currently the health information systems in Pakistan are somewhat existing in the private sectors, but in public sectors still faces a great challenge in development of these efficient health systems due to the fragmentation of systems and variation in geopolitical and socioeconomic conditions. And the first priority setting followed by the involvement of stakeholders and convincing them to start at on national HMIS policy and plan. So there is a need for increased surveillance of vital registrations if census is not possible. Here is another paper published recently that shows that integration of public sector healthcare information system with private sector healthcare providers in Pakistan. But there are some challenges and some opportunities and some solutions. So for this health information systems to work in collaboration with these district health systems, there is a pressing need for exploring and facilitating the effective use and integration of the public sector district health information system with the private healthcare sectors in Pakistan, so that the overall health information system can be improved. Last is that a stakeholder perspective and deployment strategies of health information exchange illustrated through an in-depth case of Pakistan. Data was collected through several stakeholders and field notes and critical reviews. And the results of this survey showed that the government policy is directive for evidence-based decision making and supply of electricity and training and widespread adoption of common data standards. And there is need for the improving the governance and capabilities and bolstering the information skill base in Pakistan and indeed in many lower middle income countries. So now it's time for the MCQs. In a city XYZ, our research team wants to see the course of disease and survival, the valuable data on morbidity and treatment in respective to the respective population. Which of the following data source will provide the relevant information to the research team? Either the disease register, the outcome health service records, the environmental health data records, or health personal source.
A?
Yes, the answer is A, because whenever there is a need for the information on the course of disease, survival, and morbidity and treatments, then the disease registers are the most appropriate choice. In a country XYZ, census was done to see the population characteristics. The main approach used for the census was to include only those people living at their permanent residence, excluding guests and relatives. This type of approach used is de jure, de facto, de jure, de jure. Yes, the answer is A, de jure, in which the guests and the temporary people or the visiting people at the residence is not included in the census. In a country XYZ, a group of students want to do research on prevalent diseases. in the country using the primary data source, but the system of disease notification and vital registration is weak. Which of the following will help obtaining the relevant data? Either the hospital records, the quantitative data, health personal sources, or health service records?
A.
Yes. Whenever the disease notification and vital registration system is weak, and we want to have data on data on prevalent diseases, then we go for hospital records. For the Ministry of Health to manage and compare data between facilities, districts, and provinces, the HMIS must have the standardized computer programs, data collection tools, Ministry of Health visions, objectives, or annual action plans.
C.
For an HMIS to be standardized and for the comparison between the facilities, district, and provinces, the data collection tools must be standardized. The data is collection tool that keeps patients' clients' information, including the identity, history, diagnosis, or service provided, is by the outpatient department registers, community diagnosis registers, patient records, inpatient department registers.
Outpatient department
Yes,
register.
outpatient department registers maintains most of the information related to the patient. In a village XYZ, a team of healthcare workers want to do a household survey to find about the etiology of the prevalent diseases in a respective area. Which of the following type of survey would be appropriate? Community diagnosis survey, disease factor investigation survey, health service survey, or demographic survey? Whenever there is for a survey for the etiology of the prevalent disease, we use a disease factor investigation survey. B is the right answer for MCQ number 6. Due to HMIS limitation, data reporting is complemented by the following system, which has become the main source of information system in Pakistan, that is Ministry of Health Information System, Pakistan Health Information, District Health Information, or Management Information System.
C.
Yes, the District Health Information System has now become the main source of information system in Pakistan. In a country XYZ, a government wants to develop a system for the prevention and control of emerging epidemic diseases in respective area with weekly reporting system to the higher officials. Such system is the part of HMIS, DHIS, surveillance system, or PHIS. Whenever you have to there is reporting on weekly basis, then there is that it's part of the surveillance system. Remaining systems report either on a monthly basis, quarterly, or annually basis. Which of the following is not an important characteristics of useful and effective information in a health information system? Which is not an important characteristic? Either it's accuracy, timeliness, completeness, or economy.
Economy.
Yes, economy is not an important characteristic because accuracy, timeliness, and completeness is appropriate is important for an information to be included in the health information system. And last is that as a company wants to design an efficient health management information system design. For this purpose, the source of information included for this HMIS system may be categorized as internal source information, external source information, personal or organizational information, useful or unuseful information, constructive or destructive information. The answer is A, and I shall explain that internal and external sources both collaborate. The internal sources are the sources from the organization or the management itself, and the external sources are from the stakeholders and the other companies. So the collaboration from both internal and external sources makes an efficient health management information system. This is the key. These are the references, and thank you.
Okay, thank you very much, Dr. Amber. Very good presentation. As far as the graphics are concerned, time management, presentation skills are concerned, and the communication you have made on a very important topic. There is a lot of good things in this presentation. If you please go to your slide number 3. I just noted that in slide number 3, you have talked about a very important thing, a very important concept in your MCQs, please. MCQ number 3. Right. So in a country XYZ, a group of students want to do research on prevalent diseases in the country using primary data source, but the system of the disease notification and vital registration is weak. Which of the following will help them obtaining relevant data? And you said it is hospital records. As far as this scenario is concerned, it is very relevant to Pakistan. We have a very weak system of vital registration, and the disease notification system is also weak. So this is something that we daily faced. So it is a very important issue that you have highlighted, and thank you very much for bringing up this point in discussion. Yeah, however, I think that if there is a multiple sources of the data are present, they help in triangulation and they help to find out the relevant data, because you have asked about the relevant data. So health personal sources, yes, they can also be a very good source. Health services record, especially where these services are provided institutionally. We know there are many institutions like CMS, Fauji Foundation, and social security systems that have the health service record for their employees. So it is again a very relevant source of the data. So if you are asking about the relevant data, the yes, it can come from the hospital as well as from the health service records, from the health personal sources even, especially in insurance systems. We have seen there are many people who are having their health insurance, life insurance, and they have to go for health checkups. So health personal sources, again, it is a very good form of data. We also know that there are certain hospitals and who are providing community services, and they have outreach centers like Fatma Memorial Hospital, Aga Khan Hospital, Al Shifa Hospital, and they are not only maintaining the hospital record, but they are also having a very nicely jotted down the personal sources, community services, home care, primary health care centers, and their data is coming through all these things. So as the quantitative data, again, it is the most of the data that we are discussing is quantitative data. So I think if we have to choose one of the best, then all these options are one of the best option depending upon the circumstances, context, and where it is being offered. However, I think you must have to rephrase this MCQ, because the relevant data is present in each and every option.
Okay, ma'am.
Moreover, it is a very important point that you have highlighted, and I am very glad that you brought it into discussion, that this is really a weak area where more work has to be done and more effort has to be put in. Very well done, and Allah bless you. If anybody has any question, please do ask here. Okay, thank you very much, Dr. Amber.
Thank you, ma'am.
Allah bless you for making such a wonderful presentation.
Thank you, ma'am. Allah Hafiz.